I'm very happy to be here to stand with you against these deeply concerning policies, these cuts, these attacks on our healthcare system from this UCP government over the last 3 years that are being amplified and made even worse under Danielle Smith. I recognize today is the International Day of Persons with Disabilities. And I recognize that so many of these hurtful changes, these policies, these decisions for the UCP government have been particularly damaging for access to care for Albertans who live with a disability. I know here in my constituency, I have many constituents who reach out to my office, who are on AISH, who are on income supports, waiting to get on AISH, who are struggling to get by, and face, in many cases, very serious medical conditions that cause challenges for them every day. And in so many ways over the last 3 years, this government has made their lives harder. Marie's going to speak to this more, but I know some of the changes they made to de-indexing AISH and income supports, taking away additional housing supports. I have talked to people in my office who are facing eviction because of changes forced through by this government. And on top of that, we have seen their constant attack on our healthcare system. From the first day they came into office, attacks on healthcare workers, frontline workers like nurses, paramedics, others. Their attacks on doctors that lasted for 2 years through the midst of a pandemic, driving many out of practice and out of province, making it more difficult for each one of you to be able to access the care you need. We saw them throughout the course of the pandemic repeatedly put their politics ahead of public health, dragging their feet on taking actions to protect your health, to protect your lives, to support you in the community. The level of arrogance, entitlement, and privilege that we have seen from this government, from its ministers of health, from its MLAs, as they fought against the very things over the last 2 years that were keeping people in our province alive and were protecting your health.
We have a real problem that we don't have benchmarks. We don't have goals to say, how far did we come? So to people with disabilities, are we moving people out of poverty? Are we moving people out of unemployment and underemployment? Do people with disabilities have the access to health care that they need and they deserve in their communities? We don't have those benchmarks, so we can't look back and say, did our investments work? Did the direction that we're going work? We don't have that. And so what I know with the NDP government, if we form government in 2023, this is something we will look at.
You're going to.
We're going to. Yes, we are. Well, that's the plan. We're working towards that for sure every single day. Actually going door knocking after this. So yes, we are working on it. So I hope that every year when it is International Day of Persons with Disabilities, that we can't just celebrate and say, hey, it's that day again, but that we will say, we've come this far in 12 months, we've made this progress. Whether it's in post-secondary education, that we have more students with disabilities that are graduating and being employed in their fields, that we have people moving out of poverty, that we have accessible childcare and inclusive education for every single person, not just for people with good advocates, for everybody. Access for everybody. Alberta is one of the only provinces in the country that does not have accessibility legislation. Happily, there is federal legislation. Does it need work? Yes, of course it needs work. But Alberta doesn't even have that kind of legislation that sets out accessibility and inclusive targets for every aspect, not just about ramps and the built environment, is it accessible, but around communication. Is it accessible? Can everyone communicate and understand what's being communicated? It's about employment and underemployment. It's about procurement. It's about every aspect of government, and we don't have those benchmarks. We don't have that kind of legislation. So you have our commitment as Alberta New Democrats. It's going to be a new world for people with disabilities, in my opinion, if we form government in 2023.
Awesome. Well, Tansei friends, Blake Desjardins, Nisagasan, Pakjahanse, Miskuchiwa, Skaiga, Notsinia, Otepemiswak, Nia. For those who are gathered here today, thank you so much for creating a really important space. A space on a day like today where persons with disabilities from across the globe are uniting shoulder to shoulder to talk about the gaps in service, not just in their countries, but right here at home, right here in Canada, right here in Edmonton, Alberta. We're seeing some of the most egregious attacks on public health care we've seen in a generation. In a generation. The generation before us fought to ensure that our public health care system was properly funded. The generation before that fought to ensure that we actually had a basic healthcare system. And today, we have the challenge of defending it. And each and every one of you are on the front lines of that defense right now. You're ensuring that this government, this UCP government, does not trample on your fundamental right to access publicly administered, publicly accessible healthcare here in Canada. That's huge. The kind of courage that you have in your hearts right now here today is the kind of courage that a government should have. It's the kind of courage that Canadians from coast to coast to coast have had throughout this pandemic and continue to have. But we need leadership to actually demonstrate that. We need leadership that actually shows up for the things that matter most to Albertans. And right now, that's healthcare. My friends, people are being left out. We've seen just earlier last year what a UCP government will do when it decides who is not worth their care. We've seen not that long ago the introduction of, the ending of the indexing of age, for example. Criminal in Canada during a time when the cost of living is so critical. My friends, you showed up and you fought to ensure that they would see the pressure of bringing down our social safety net. And you fought back and you've seen progress, but it's just not enough. We need a government that actually is proactive. We know that if we invest in the prevention of care, things like dental care, things like pharmacare, things like vision care, and ensuring that we have a basic livable income in Canada will actually ensure that everyone gets ahead. That's something each and every one of you have showed up for every single day, and you're showing up right now in front of the legislature.
We stand here today for those who are too sick or homebound, in hospital, or couldn't make the journey. You are in our hearts and minds. I got a message on Twitter from Mary yesterday who would like to be here, but her support workers don't work weekends, so she couldn't come. Support should be there. Our disabilities don't get weekends off. Today, December 3rd, marks the International Day for Persons with Disabilities. We celebrate that as Canadians, we are working towards disability inclusion, accessibility, innovation, and fighting inequality. We have made great progress, but still, we need to do more to protect human rights and our health care. In the last few weeks, since Danielle Smith has become Premier and leader of the United Conservative Party, we see a direct attack on these human rights and are a threat against inclusion, accessibility, innovation, and equality, not only for the disabled community, but for all of us. At a time where our federal government is in talks to make dental, vision, and prescriptions universally covered, plus a new disability benefit, Danielle Smith wants to take it all away to privatize healthcare. What does this mean for us? It means selling our healthcare to for-profit corporations. Who suffers most under this plan? 6 other provinces have conservative governments who have also underfunded their healthcare systems. You can bet today they're watching. This is not just an Alberta problem, it's a Canadian problem, a human problem. To go in front of Albertans and boast about a surplus while they're dropping off trailers at the Children's Hospital and removing respite staff for terminally ill children and not even standing up to acknowledge that is unacceptable. It's disgusting. Shame on them. I am angry. I stand here today as a terminally ill mom of a NAIT student and a dialysis patient. We must let our politicians know that the suggesting that we applied for MAID isn't an alternative because supports aren't there for those who need them. I didn't think I would be using my possibly last days, weeks or months to fight against a government who wants to bring in US-type healthcare with user fees, co-pays, and insurance companies who will make medical decisions not based on need, but the ability to pay. But here I am. This goes against the basic tenets of our healthcare system. We need to vote out the UCP and Danielle Smith like our lives depend on it, because they do. Yes.